Happy Friday, everybody. Hope you had a great week and that you're excited for the week to wind down. Today we're going to be talking about HIV Prevention Tools with Whitman-Walker Health. Just going to get my colleagues here into the room and we'll get started in just a moment. All right. Hey, Corey, how are you?
Hey, great. How are you?
Good. Happy it's Friday.
Yes, me too.
How'd this week feel? Short or long?
It actually they've been going really fast.
Interesting. Still speeding through.
Yeah, the weeks for me have been like they have been going really fast. Um, so yeah, that's actually been a good thing because I don't really like to drag along. I actually kind of go ahead and get out of there.
Your video is cutting in and out for me a little bit, or the sound's cutting in and out.
Okay, hold on. I have my tripod. Let me put my phone on. That usually makes it better.
Any plans for the weekend?
Nothing really planned as of yet. But I always typically find things to do. I'm trying to pull. I'm trying to pull up the script. Since we did them, here we go.
Hey, Paul, how are you?
Since we did them in advance, they are kind of like down the roster.
Cool. In the meantime, folks, if you're looking for a place to get tested or get your HIV or STI testing done, please reach out to Whitman-Walker Health. You can call us at 202-797-4439. That number is pinned in the comment section. We do self STI testing for gonorrhea, chlamydia, and I'm missing one. And syphilis. There we go. And then we have quick 1 minute free HIV testing. Everything's completely free. We just want to make sure that that we are a resource here for you. We can support you with your sexual health journey, and you can talk to a medical provider if you have any questions or or if anything comes back positive. We can walk you through medication and get you access to treatment and get you back ready for sexual activities and dating and stuff. Also want to acknowledge that yesterday was Transgender Day of Visibility, so happy belated Trans Day of Visibility to our transgender, expansive, non-binary communities. We celebrate you and you living in your authenticity, so thank you for being you and being visible in community. And for all the folks who can't be visible, we appreciate you also, practicing visibility in that way. Today's April 1st, so it also marks the beginning of STD Awareness Month. So again, if you haven't been tested in a while, want to know what's happening with your body or keep up to date with what's happening with your body, please call us at 202-797-4439 to schedule your testing appointment. I think we can get started. All ready?
Yep, let's do it.
Cool. Hi, everyone. My name is Jewel, and I use she, her, hers pronouns. Corey and myself work as social media influencers with the Whitman-Walker Health team. And during the past few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platform. We cover various topics about STIs and HIV, to sexual health, access to care, social determinants of health, and just general public health interventions. The community health team is here to educate and support you. And again, today is the first day of STD Awareness Month, so please call us at 202-797-4439 to schedule your HIV or STI testing appointment. You can also visit your local Planned Parenthood or medical provider or city health department to access sexual health testing.
Hi, my name is Corey Haskett. I use he, him, his pronouns. Today I will be discussing HIV prevention tools. To end inequalities in HIV, we must increase education in what HIV testing and treatment and prevention looks like. Today in 2022, HIV is a manageable chronic disease and is more preventable than ever before. For getting tested and knowing your status is preventable, there is preventable options like PrEP or PEP, and here are a few options to consider adding to your HIV prevention toolkit. Getting tested. Getting tested for HIV and STIs is the first step in anyone's HIV prevention journey. Depending on a person's sexual health practices and activity, getting tested every 3 to 6 months can go a long way in preventing HIV and STIs. Untreated STIs make it easier to become positive after an exposure to HIV, so it's important to get tested. Learn more about Whitman-Walker's health testing hours and location at whitman-walker.org/testing. HIV and STI testing available by appointment at Whitman-Walker's location. Call 202-797-4439 to schedule a testing appointment and be sure to check out our website for most up-to-date hours. Whitman-Walker's locations are as follows: the Max Robinson Center at 2301 Martin Luther King Jr. Avenue, Southeast in Anacostia. Whitman-Walker Health at 1525 14th Street, Northwest near Logan Circle.
Thank you, Corey. And so if you do get tested and you receive a negative HIV test result, you can ask about PrEP. That's an HIV prevention tool. So it's PrEP is short for pre-exposure prophylaxis, and it's a daily pill that can prevent HIV. And according to the CDC, when taken every day, this pill can prevent a person's chance of HIV infection that's transmitted through sex by about 99%. And it can prevent HIV that's transmitted through injection drug use by about 74%. On December 20th, 2021, the U.S. FDA approved Apretude in an extended-release formulation as the first long-acting injectable PrEP option. So that's super exciting. Injectable PrEP is administered by a healthcare worker every 2 months and is indicated for adults and adolescents who are weighing at least 35 kilograms or 77 pounds roughly to reduce the risk of sexually acquired HIV. So it's actually approved for cisgender and transgender men and women with no limitations based on the type of sex that you have. This is a great option for any person who, doesn't like taking pills, or, it might be hard for you to take a pill every single day and be consistent with it because, research and studies show that if you aren't taking your pill as directed every day, that's when you kind of are at more risk for becoming infected with HIV if you were to come in contact with exposure to the virus. It's also a really nice breath of fresh air given the history of the AIDS epidemic and, all of those early days of no kind of sure medication that were working to treat HIV or help people who were navigating the disease, who had to take an obscene amount of pills morning, noon, and night. And so it's really something special that we're, in 2022 with an option for an injectable HIV prevention tool. Right. You can learn more about PrEP and decide if it's the right HIV prevention tool for you. You can contact Whitman-Walker's PrEP team at 202-939-7690. Again, that's 202-939-7690, or at prepclinic@whitman-walker.org. That's an email address. It's prepclinic@whitman-walker.org. And if you're living in the DMV or the DC, Maryland, Virginia area, you can access PrEP in DC and find a service location near you by visiting sexualbeing.org. Maryland residents can access PrEP by visiting marylandhealthconnection.gov, and Virginia residents can access PrEP by visiting vdh.virginia.gov. Again, that's VDH, as in the Virginia Department of Health, .virginia.gov. PrEP may be a good HIV prevention tool for you if you've been diagnosed with an STI in the last 6 months, if you're sexually active and don't always use external or insertive condoms, if you're unsure of your sex partner's HIV status, if you are HIV negative or are sexually active or have a sex partner who is living with HIV, or if you identify as someone who injects drugs or is having sex with partners who inject drugs. These are all really great reasons to consider taking PrEP as your HIV prevention tool.
Yeah, and just to reiterate on what Jewel was talking about earlier, I've actually had clients that kind of like told me stories about from the time that she was referring to where people had to take like a plethora of medication that were HIV positive. Like it was like to the extent of like sometimes 20 and 30 pills a day, and sometimes multiple times a day because of that was that what their regimen consisted of. So we are in a time where that can be prevented, and that's that's not what's going on anymore. So I'm just actually really thankful for that. Yeah, but if you are HIV negative and think you have been exposed to HIV, ask for PEP. PEP, or post-exposure prophylaxis, is a 28-day course of medication that can prevent HIV after a possible exposure. PEP is most effective when started within 72 hours of an HIV exposure. PEP is for emergency use and is available at Whitman-Walker. To access PEP with Whitman-Walker, call our PEP line at 202-797-4439. Again, that number is 202-797-4439 for support through our Logan Circle and Anacostia Health Centers. PEP is also available in all emergency rooms, whether exposed to HIV through consensual or non-consensual sex or sharing needles and works. It is important to seek PEP within 72 hours of exposure to HIV for it to be most effective at preventing HIV. DC residents can access PEP by visiting sexualbeing.org. Maryland residents can access PEP by visiting marylandhealthconnections.org. Virginia residents can access PEP by visiting vdh.virginia.gov.
So if you have actually received a positive HIV test or are living with HIV, you can start treatment for HIV. You want to talk to your medical provider about your treatment options. When a person is living with HIV, they can manage their HIV by taking HIV treatment as prescribed, and by being on treatment, you decrease the risk of passing HIV on to someone else. This is known as treatment as prevention. So by actively participating in your healthcare, by taking your HIV treatment, you decrease the chance of giving HIV to another person. So you're actively being a public health superhero. People living with HIV who take their treatment as prescribed can achieve an undetectable viral load. An undetectable viral load means that there is effectively no risk of a person transmitting HIV sexually to another person. This is also known as U equals U, or undetectable equals untransmittable. So missing your HIV treatment puts you or a person at risk of regaining a detectable viral load. So it is important to take HIV treatment as prescribed and as directed by your medical provider. If you're starting treatment, you can start treatment by calling Whitman-Walker Health at 202-797-4437. Again, that's 202-797-4437. And when you call, you can just say red carpet to any of the team members who answer the phone, and they will support you in getting an appointment at either our Logan Circle location or Anacostia Health Center. You can also call us at 202-745-7000 or email us at appointments@whitman-walker.org to schedule an appointment. Just mention red carpet, and our team can help any person start treatment for HIV. If your community or organization is interested in the Whitman-Walker providing mobile health services in your neighborhood, so that's when we bring our mobile van out. We do HIV and STI testing. We can do PrEP starts. We can help you schedule a COVID-19 vaccine appointment. You just need to contact mobile health at whitman-walker.org, and we'll schedule some time to be in your neighborhood. But please access PrEP, or start HIV treatment with Whitman-Walker Health at our Max Robinson Center or our 1525 14th Street Northwest location. Our team is here to help you. And again, you can call us at 202-797-4439 to schedule an HIV or STI testing appointment.
Okay, guys, before we go, we want to give you a few reminders about COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You have taken a really important step to preventing yourself, your loved ones, and your community from illness. Variants are soaring across the United States at the moment, and it's totally understandable why people might keep wearing your mask because the vaccine isn't 100% effective. More contagious variants are spreading, and there are very few protocols in place to actually verify if someone has been vaccinated. Keep staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccines available. Everyone 12 and up are eligible to receive a COVID-19 vaccine. Please reach out please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us for DC residents, someone is changing the script as I'm reading it.
Sorry, I deleted two things. We've just had some changes in FDA approvals for vaccines in the last couple of days. That's the only change, though.
Okay. If you're having trouble making an appointment with us for DC residents, you can find the information on COVID-19 vaccine walk-ups, locations, eligibility at vaccine.dc.gov, or by calling 1-855-363-0333. Track the speed of COVID-19 vaccination lines by visiting coronavirus.dc.don't wait. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit their vaccination registration portal. If you live in Montgomery County, visit their vaccination portal or call 240-777-0311 to schedule an appointment. For Virginia residents. Learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you get the vaccine. Discuss COVID precautionary measures with those around you. Be mindful of masks and keep your distance, especially when you do not know whether a person has been vaccinated or not. Remember to follow us on Instagram, Facebook, or Twitter at Whitman-Walker, and checking our website at whitman-walker.org for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. Follow some more of our programs at Whitman-Walker Family, at Real Talk DC _ and No Filter DC.
Well, thank you, Corey. Thank you, everyone who tuned in. We hope you learned some great information about HIV prevention tools and know that today in 2022, HIV is a manageable chronic disease and no longer a death sentence. And if you test positive, you can get on treatment and live a full and healthy life and, pass away from something very different than HIV.
Right.
But cool. Happy Friday, everyone. Hope you have a great, great weekend.
Happy Friday. Bye, everyone.